Okay, so a couple things. So if I'm going to drop my weight, I'm not the heaviest guy in the room, so I like it to be low. So I always put it down as low as it can be. You'll see some people that will go like almost like lateral femoral condyle, and having some parameters so that I'm consistent in my setup will ensure that if something is amiss or does go well, I can rest assured that there's controlled variables. So I'm going to put two fists down on the edge of the table, and I'm going to have Cam go ahead and scooch up just to the point where he can is about that distance away. Okay, I'm going to flex his bottom leg up, and I'm going to ask him to kick his bottom leg out straight. So a couple things. Watch what happens when I let go. That's not okay. He needs to be more balanced. So Cam, I'm going to ask you to shimmy this hip towards me. Boom. And usually giving him contact on both sides helps. Otherwise, sometimes patients will just like rotate or just move themselves closer to you, which you don't want. If I let him go, he still rotates. Cam, you need to do a better job. Sorry. You need to be like that. Yeah. All right. So that's better, right? I can take my hands off and he actually stays. Couple of key things here. I like to lock in the foot. I also make, this is key. So when he rotates, there's clearance. Otherwise, when he rotates, it's just going to be blocked by the table. I intentionally put him into a little bit of hip flexion as well, so that this leg is coming forward. If you can appreciate that, this bottom leg is not quite into an extended position. It's flexed. So he already told us that he's mobile, so we may need a towel or we may need to leverage the table up. If you take this arm, Cam, and then again, so I'm gonna, because he's more mobile, I'm gonna add a little bit more flexion. I'm not gonna, I may be tempted to add more rotation because he has the mobility, but that's gonna reduce what is gonna be my primary force. So I'm gonna just go ahead and flex down, and I am gonna pull him through. It can be a little bit uncomfortable on the scapula, so you always just gotta check with them to make sure that that's okay. Are we okay there, Cam? Yeah. Great. And then I call it the supermodel pose, so I'm just gonna go hand there. I'm gonna bring that there, and he's set up. I take a moment just to look. Can't keep him there for too long, and we'll thank you for that. But I'm just gonna add a little bit more flexion. The tipping point. So if I come over, and I just give him a little bit of nudge. Perfect. He rocks, he doesn't lose balance one way or the other. So that means that he's in a good balanced position. Not on glenohumeral joint, not on boob, like right on the pec. This is key. If you come around, my short lever applicator, so it's right here along my pisiform, okay? Here's his spinous process. Here's his multifidi mass. I'm gonna come in lateral, right over the transverse facet or so, right over the articular pillar, and that's gonna be my thrust, my short lever applicator right there. If I'm on the spinous process, I'm not gonna get a rotary torque in my short lever applicator. My long lever applicator is gonna be his thigh, not what we saw where you get the osteopactic pull where you're here. So it's gonna be like this, and I'm gonna be dropping my weight using the leverage of, essentially, this is my contact point. When we go ASIS, and when our ASIS kiss, I drop. I'm gonna try my very best to dissociate his shoulders from his hips. So I'm gonna block the rotation here as I thrust his pelvis down towards the floor. It's usually when his pelvis reaches 45 degrees is really, and that's where our ASIs should kiss, and I'll drop like that. Okay, it's you need to have higher forces. I need to provide 100 pounds of force or so. Cam, you doing all right?
Mm-hmm.
All right. Thanks for putting up with me. So big breath in, big breath out. As you rotate him towards, then I come here, make sure I'm there, and then I drop. Other side.